everyone. Thank you for joining us. This is Trusting Dr. Google. This is part 2 of a series. So if you did miss the first part and you want to go back, that is going to be posted on our library YouTube channel. You can watch that throughout the summer through August 7th. We will have it posted there. That's the same with this video. Although if you are watching live, welcome and thank you for joining us. I do want to let you know a few things. So we are so excited to host for the second time this week, Jacqueline Kastick and Angela Novick of Tampa General Hospital. They are health research librarians who are going to bring us some great information about health resources that you can use to do your own medical research. So some of the things I want to mention at the top of the program, the first thing is we do have a question section. So we are going to do live Q&A at the end of this program. So if you look at your control panel, you can submit questions at any time throughout the program, and then we will answer them live at the end of the program. Now, I do want to put a proviso on this. The questions should probably be about medical research. They won't be answering any questions about personal medical conditions. So please don't share those questions, but anything else you can go ahead and type in the question section. The second thing to let you know is while you're looking at the control panel, there are 2 handouts attached. So you can download those at any time throughout the program. So those are going to cover some of the information that they will be talking about today that you can download, read later, print, and take with you. There is going to be a brief survey after this program. That lets you know, it just takes a minute or 2. We ask that you do fill that out. That lets us know your opinion and give you the chance to give us the feedback if you have any information, or just lets us know how we can develop programs that you are interested in. So we would really appreciate it if you fill out that feedback and send it back to us. And then the last thing is I will be posting the websites they're discussing in the chat section of the GoToWebinar control panel. So if you do want to follow up with one of those websites, you can just click the link. It will open in a new tab, and you can come back to that tab later. So without further ado, I am going to pass it over to Jacqueline and Angela for introductions, and then we will get started.
Hello, I am Jacqueline Kastick. I'm the manager of the library at Tampa General Hospital.
And I am Angie Novak. I am the medical librarian at the medical library at Tampa General Hospital.
Okay, well, we are going to turn off our webcams for now. We will be back later, but we will go ahead and get started with Trusting Dr. Google Part 2, How to Find and Evaluate Online Health Information Resources.
Okay, well, thank you all so much for coming to our webinar here. Just a little introduction about us. Like we just mentioned, we are both librarians with master's degree in library and information science. And as medical librarians at Tampa General Hospital, we assist all of our Tampa General team members, which includes doctors, nurses, pharmacists, nursing students, physical therapists, medical students, and hospital administration. And we help them to find evidence in the medical literature that can help them make patient care decisions to ensure that we as an organization are providing the best care in a cost-effective way with quality and safety that are leading our decisions. So most hospitals do have, most major hospitals have medical librarians, and some even have libraries specifically for patients and their families. There are also medical libraries at medical schools and nursing schools. So just kind of a little background about us. But today we're going to be providing some information on consumer health and how to find trusted information online. So what we're going to look at today is a brief introduction to consumer health information on the internet. What is health literacy and why it's important? Where to locate reliable and accurate websites for health-related information, how to evaluate if a website contains trustworthy information, and what to do with the information that you do find online. So we just have a quick video here that we wanted to show. This is just a representation of kind of what it's like to actually go online and search for health information in just sort of a comedic way. So we like to start off with this just so you can get a little idea.
Hi, I'm Dr. WebMD. Can I have your name, please? Jake. And your email and zip code. They're optional. Great. So what brings you in here today? Well, you're free. Too embarrassed to see a real doctor? You got me. What is it, Doc? You have cancer. How could you possibly know that? Oh, I tell everyone they have cancer. Why? What seems to be the problem? Besides the cancer. I've been going to the gym more lately, and the upper part of my shin really hurts. I don't know anything about that. Oh, okay. What if I just say my shin hurts? See? Told you. Cancer. I really don't think I have cancer. Nobody ever thinks they have cancer. The symptoms can take many different forms, such as throbbing in head, runny nose, mild cough, stress, or one of 14 other things. Do you eat vegetables? Yes. 13 other things. But I have to tell you, 8 of them are STDs. What should I do? Xanoflex? Jesus. No. Tell you what, I'm going to write you a prescription for 10 tips on how to have a healthy summer. And don't forget to bring a beach ball. See my nurse on the way out. She can recommend some great beach ball clinics on the west side. How does that help my shin? For a more complete examination, please see a doctor. What are you?
I really think that you should use some Xanoflex. You just take a small dab, rub it on your belly.
Enough with the Xanoflex. Sorry about that. They're one of my sponsors. You know what? I'm leaving. And who are you going to see? You don't have health insurance. I guess it starts acting up mostly when I'm going up the stairs. It's definitely AIDS.
Okay, so that's just a fun way of looking at kind of what we all do when we search for information online, when we look for symptoms, and honestly, we've all kind of done that, and that's just a fun way of looking at it. So, no, okay. So just a quick disclaimer, health information found online is in no way meant to substitute medical advice from a medical professional. So we definitely always recommend consulting your provider before making any healthcare decisions. All right, now if you did attend our webinar yesterday, we're going to kind of overlap a little bit because we do still want to talk about consumer health if you did not attend yesterday's webinar. So consumer health is any information that enables individuals to understand their health and make health-related decisions for themselves and their family. So it's being able to use this information, being able to use information that you find online, especially to be able to make decisions. So the definition of health literacy itself is the ability to obtain, read, understand, and use healthcare information in order to make appropriate health decisions and follow instructions for treatment. And having high health literacy is an important skill that will help you make the right healthcare decision for you and those you care for. And when you have high health literacy, it allows patients to be able to communicate better with their healthcare providers more efficiently, and it allows patients to use information to make better healthcare decisions. So as you can see, it's a really important element to not just being able to find information online, but being able to read and understand it and how to use that in your daily life. So why is health literacy important? Health literacy may be a new concept for some of you, and you might be asking why it is actually important in this case. And the answer is that health literacy is directly related to how you find and understand health information like we've covered, but it's also an essential life skill. It can help us as patients find health information and use that information to have more control over our health. And each individual plays a part in helping our community stay healthy, so that the more we know, the more we can help our communities thrive. And as our communities thrive, we can begin to help those who have low health literacy or health inequalities, which in turn actually helps the economic issue that we might have related to healthcare, because it is estimated that low health literacy costs the U.S. economy $73 billion a year. So the more we raise health literacy, the more our economy can improve on the healthcare side, from savings from additional hospital visits, higher healthcare costs, and the number of other factors that cost us money in the healthcare industry. So now that we've covered health literacy and why it's important, we can actually talk about the consumer health portion element of what we're here for today. So a survey taken in 2012 shows that at least 70% of adult internet users has searched the internet for health information. On Tuesday, when we did part 1 of this, it was 100% of our participants in that session. So the internet is definitely used widely for many different reasons, which can include concern over a new diagnosis, being able to make more informed healthcare decisions, even reduced anxiety when you have uncertainty about an unknown health concern, or even to get support from others experiencing the same condition or disease. And we can see in this graphic, some of the common reasons or common Googled questions from 2017 are things like what causes hiccups, what causes kidney stones, how to lower cholesterol, what is lupus. So some really important healthcare questions, and they can range through many different topics. So some other commonly searched health topics might include medication side effects, symptoms, information on medical devices or surgeries. You might also be looking for natural remedies or guidelines and recommendations. So there's just such a wide variety of information that you can search for online and that you can find online as well. And there's advantages and disadvantages to searching for information on the internet. Some advantages is that the internet is everywhere, it's always on, always accessible. There is so much information that you can access, so it's not like you actually have to go to a physical place and look through a book to find information. It's all there online and accessible. And you can share information easier. You can print it, you can take it to your healthcare provider. You found, a great article or a great, information about a certain topic. You can share that with your family members with just a click of a button. So it's really easy to save, print, and share information online. Now, some disadvantages, and this kind of goes along with that image that we have shown there, which says getting information off the internet is like taking a drink from a fire hydrant. And that is so true, because the information that you get online can be an information overload. It's all just blasting right at you, no filters, no way to necessarily decipher, what might be good and what might be bad unless you have those skills to understand it. So some other disadvantages is that information that you find online can be misleading, inaccurate information. There might also be malicious intent behind some of the websites out there, like advertising, or they want you to pay for content or products. There could also be outdated content. The healthcare industry changes day to day, so the information can easily become outdated, and that can be harmful if you're viewing outdated information. And you may need skills to search efficiently and effectively. So that's kind of what we're going to look at today, is how you can, what skills you might need or what information you might need to know to really find the best resources online. So I'm going to turn it over to Jacqueline, and she's going to go over some different elements of how to spot, a good resource online.
All right, thank you, Angie. Angie just talked about some of the pros and cons of using the internet to find health information online. Luckily, there are several hallmarks of quality that you can use to guide you in being able to tell if the information you find on the internet is reliable and of high quality. So these hallmarks of quality that you need to look for, and that we'll go into a little more detail in this portion, is the information accurate, current, relevant, evidence-based, free of bias or ads, reliable, understandable. So in our first class earlier in the week, we gave an overview of the top 5 websites that you can find reliable and authoritative health information. And each of these resources does meet all of the hallmarks of quality that were just mentioned. And these top 5 resources are Medline Plus, National Institutes of Health, the National Library of Medicine, Centers for Disease Control and Prevention, and the Merck Manual Consumer Edition. Now, all of these sources are constantly being updated with the latest changes, and as we know, medicine is always changing as new research comes out, which is ever more true these days. The content provided by all of these sources is also reviewed by medical professionals and is written in a way that is easy for the average consumer to understand without having to do a lot of further information. So the information you can find in all these sources is consumer health information, which means it is that information that is written in a way that's easy for consumers to understand and therefore be able to use to help them make more informed healthcare decisions. There are a few other trusted internet resources that you can turn to find some reliable health information. You can try checking your local or state health department website, your health insurance company website, the FDA, and then you can also check, depending on what it is you're looking for, the disease-specific organizations and associations that many of us are familiar with, such as American Cancer Society, American Heart Association, National Mental Health Association. So these are very good resources to find reliable information. And a lot of these that we mentioned on this slide and the one before, you will find some crossover because since it is all reliable information, they do tend to share information as well. Now, not included on this slide, which some of you may have used before, are online forums and discussion boards. So it's important to remember that while these are great places to find emotional and moral support, they are not supposed to be used for medical information. So of course, any recommendations that you find here that you think may be useful for your specific concern, you should take those and discuss those with your doctor or serve as a basis to search for more information from reputable sources. So next up, we have a quick poll, which we're going to ask you, where do you normally look for health information online?
Okay, I'm going to go ahead and close the poll and I will share results. Okay. And you're able to?
Yep, I can see the results. So it looks like most people said Google, which is usually the first place I go as well, which is a good place to start. WebMD is pretty good. The only thing we kind of would be concerned about that is to make sure you're looking at what kind of advertisements are on the page you're looking at, because it is a little more commercially driven than these other resources. And then disease-specific organizations is a really good place to look. So Google can be a great tool if you're able to evaluate the sources that come up in your search results. And you can do this by using the hallmarks of quality as your guide when you're looking at your search results that you find in Google. So now we'll take a closer look at those hallmarks of quality. As a reminder, these are that the information is accurate, current, relevant, evidence-based, free of ads or bias. The information is reliable and it's understandable, which is most important if you're going to be using this information to make decisions. You need to be able to understand it. So questions you want to ask yourself when you're looking at a website are, is the content up to date? So to make sure that this content is up to date, like we said, in medicine, things are always changing. So you don't want to use information that was from 1992 today, because a lot of that could have been changed, or better ways could have been found, better treatments, safer care, and things like that. So ways you can check to see if the content is up to date. You can usually check at the bottom of the page or at the end of an article if you're looking at, and it should say when it was posted or when it was most recently updated. Another red flag is if you're looking at it and it has a lot of links that are broken or no longer exist, then that's a good sign that it's not been updated. And again, if there's no date there at all, that's probably a sign that it's not very reliable information. You also want to ask who is responsible for the content. Is it maybe a drug company? Is it an unknown source? Is it maybe a 14-year-old in your neighborhood who just wants to put information on the internet? And along those same lines, you want to ask, what is the motivation behind the website? So does it seem like they're trying to sell something, or really just give you quality information? And again, along those same lines is, how was the website funded? Does it seem like it's mostly funded by advertisements? Is it funded by a government agency? Is it funded by readers, such as subscription-based or pay for content? Additional questions you may want to ask is, does the information reference evidence in the form of research articles published in scholarly journals? So to be able to tell this, you can usually look at the bottom of the page or an article to see if they've referenced any articles or published scientific studies. Sometimes they might not be listed at the bottom, but the research studies may be linked within the content of the article. Now you just want to make sure if you click on those links for the journal or the scientific studies that it takes you to a journal website, or maybe a journal index like PubMed, just to be sure that these are actually scientific studies from peer-reviewed journals. Now, if you're looking at a website and it doesn't list any references whatsoever, whether it's journal articles, scientific studies, the CDC, PubMed, one of these more reliable sources of information, then you probably want to take a second to think about if this information is really reliable, because usually the most reliable forms of evidence or reliable sources of information will tell you where they got that information or that evidence from. You also want to ask, does the website ask you to provide personal information? So a reliable source for information will never ask you to provide personal information, credit card numbers, anything like that. If you come across a website that does, just remember that there are plenty of other websites that do not ask you for any of this information to provide you with quality information. And we did give you those top 5 that are great places to go to that would never ask you for any information like that. We did mention one of the hallmarks of quality was it free from advertisements or biased in any way? So we have a quick word on website advertisements, because it does become a big problem when you're looking through search results from Google. So placement, when you're looking on a website, the advertisement should never interrupt the main content. So the amount of advertising content should not outweigh the informational content. So if you're looking at a website and you can't really get the information, maybe it gives you a sentence or two and then it puts a big ad in the middle, and then there's another sentence or two and a big ad, you can tell that really the motivation behind this website is to make money on advertising. So it's really not going to be the most reliable source for information. You also want to think about clarity. So it should be clear that the advertisement is separate from the informational content. A lot of times you'll run across, especially I notice in results in Google, and you have to really make sure that you see that it says sponsored ad, because sometimes it does look like a legitimate search result for information, but it really is an advertisement. So really be paying attention for that, and it should be clear that the advertisement is separate from the informational content and not confusing. If it's confusing, if you tell, is this an ad or is it just information, then it's probably a red flag for you. And of course, the informational content should not aim to sell a product or elicit you to buy something. So this I see a lot of times for maybe certain medications or treatments. They act like they're giving you information, but really every other sentence is, you know, this product is the one to buy, this product, the same product over and over again. So that's another red flag to look out for. All right, so let's say you're doing your search on Google for some health information. We're going to give you some tips for locating reputable websites when you're doing a search. So you can start out using your favorite search engine. I know most people just automatically go to Google these days. When you look at the results that come back, look at the URLs and the endings that they have, because they can really give you some hints and clues whether or not it's going to be a reputable website. So typically the reputable websites are .gov, .org, .edu, and you want to use caution with .biz, .tv, .net. .coms are kind of in the middle there. You just have to really use those hallmarks of quality when you're evaluating those websites. You can also see if you can identify any websites created by the National Institutes of Health or the National Library of Medicine. So again, in the URLs, you may see .gov, you might see NIH or NLM somewhere within that URL. And then if you're on a page, you can see if there's an NIH or NLM logo somewhere on that website to know that it is produced by them. And of course, in your results, you can also see if the information is coming from a professional association or organization, such as the ones we mentioned earlier, or American College of Physicians, American College of Preventive Medicine, American Society of Internal Medicine. These types of societies do usually have some patient information geared towards patients or consumers. Not all of them do, but if it is coming from one of these organizations, you know that it is of higher quality. Some additional search tips and tricks you can use. We always recommend trying to use Boolean operators. I know this is a very odd sounding term, but a lot of people do actually know these terms. They just don't know that they're called Boolean operators. So when you're doing your search, you can use the word and, which will, if you have two different words in your search and you put the word and in all capitals in between those words, your search results will come back with all of those words in the results. If you do the word or in between two words, it will look for that word or the other word. So an example might be, you might put doctor or physician. That way it will bring back results that have either one of those words. And then you can use not, which will tell a lot of search engines that you want something without that phrase. So let's say you wanted to look up something to do with neuropathy, but all of the results coming back were talking about diabetes. If you weren't interested in that aspect, you could always put not diabetes, and it would take those out of your search results. I know Google and maybe some other search engines use the minus symbol instead of not. So if you put the minus symbol right in front of the word with no spaces, that's another signal to the search engine to remove that word from your search results. You can also use quotation marks. For phrases. So if you have a phrase, let's say physical therapy, you could put those two words in quotations. So quotation, physical therapy, and then another quotation mark. And that will signify to the search engine that you want your search results to return only those that have those two words together. So instead of it coming back with physical and therapy talking about two different things, it will come back with it only coming back physical therapy together as the term. When you're searching Google, you can also include.gov or .org to your search terms to help you bring back those type of results rather than the more .coms, .net, those type of results. If you're looking for higher level information like journal articles, abstracts, you can try searching scholar.google.com or pubmed.gov. Now these are going to be peer-reviewed journal articles, more of the resources that physicians and other healthcare professionals will use to find the evidence. So they're not going to be written for the general consumer. So they may be a little harder to understand, but if you do find something in there, you could always bring it to your provider to discuss. And when in doubt, you can always contact your public librarian, or if there's a consumer health library in a hospital near you, you can always use them as well. All right, so we're coming to our next poll here. Do you normally prepare questions ahead of the time before you head to your doctor's appointment?
And we got a quick response on that one. It looks like 100% answered yes there.
That is great. I hope that, and I would say I'm guilty as well. I might think of the questions before I go to the doctor, but I don't write them down and I don't take them with me, and I usually forget by the time the appointment is over. So, but that is a very good practice to have. Being able to understand the information you find and actually using it to help you make more informed healthcare decisions is a really important part of having that high health literacy and playing an active, informed role in your healthcare or that of someone that you care for. So when you find your information, what do you do with this information? First, again, discuss the findings with your doctor. Don't make decisions based on what you find. You want to take the information and discuss it with your doctor. Again, be sure any information that you bring with you is supported by evidence. So like we mentioned, don't go print out a page from a discussion board where someone who had maybe the same situation as you used a certain treatment and they had fantastic results and demand, from your physician that you want this done. You really want to make sure that you bring in evidence that you find from those reliable sources to have that discussion with your physician. You want to prepare questions before your appointment, and most importantly, keep an open mind. So your provider has probably done their own research on, whatever condition or treatment that you want to discuss with them. They've had professional experience, and the evidence-based medicine model is an integration of clinical expertise, being your provider's combination of clinical skills, experience, and education, blended with patient values, so what you bring to the encounter with your own unique concerns, expectations, and values. And finally, those two are blended with using the best available evidence that's out there. So it's really a combination of things that go into figuring out what is the best course of action for each individual patient. And again, your opinions are a very important part of this evidence-based medicine process. So when we were preparing this presentation, we did discover this question builder tool that you can utilize to help you kind of articulate the questions that you want to ask your doctor and put them in a way that's easy to ask, and you can print it out and bring it to you. And it will show your doctor that you're using high quality resources to discuss the information with your provider. It's just a few short steps. It probably only takes a minute or two. But it's a really neat tool that you can try, or perhaps if you have someone that you care for, a friend or a family member that you think would benefit from this, it's nice to pass that on. All right, so now we'll just recap here. And this funny cartoon is probably something many of us have experienced from trying to figure out our own issues on our own. So never trust health information that you find online before you evaluate the source for these hallmarks of quality. Again, those hallmarks of quality are, is the information accurate, current, relevant, evidence-based, free of bias or ads, and reliable and understandable. Websites should have little or no advertising and should never ask for personal information or to ask you to pay money. When using a search engine, you can try using .gov, .edu, .org, NIH, or NLM in your search. Utilize Boolean operators and quotation marks in your search. And prepare your questions before your appointment. Keep an open mind, voice your opinions and concerns. All right, and that will wrap it up for that portion. So we'll open it for questions.
Okay, so we're going to go ahead and come back on camera here. And I do want to remind everybody you can send in any questions in that question section. You can send those in right now, and we will read them out to Jacqueline and Angela. So let me open up that section. Okay, well, thank you so much, ladies. Let's start with, we were talking about general medicine. One of the questions is there anything that you recommend if people want to look up prescription medications, or if they've been recommended a prescription, or if they can find, find more information on something they are taking currently? They want to know a little bit more about it.
Sure, there are quite a few resources. We did touch on a few of them in our part one.
I would say Pillbox from the National Library of Medicine is a great resource. It gives you information about, well, let me see, I'm sorry. There's a lot of different pill resources. Pillbox or Daily Med would be two really good resources I would recommend. And they're both from the National Library of Medicine.
They should also both in the handout as well.
Oh yes, the handout is a great place for
it. That's a good reminder, and that is also, if you go to the control panel, that's a reminder that that is a place where you can type in your questions, but you can also download those handouts, there are two handouts that you can download from this presentation.
One talks about certain reliable resources that you can just use and go directly to them, and the other one kind of goes over how, like this presentation, how you should evaluate websites.
Very good. Okay, so we're waiting for some more questions to come in. We'll give people a little bit of time to see if they want to send in any questions. Is there anything from part one that you think that we want to while we're waiting to see if any additional questions come in? Anything from part one that maybe I know there was
yeah.
If there's any additional information we want to share.
Let me double check. We went over that. I don't think so. No, we tried to really keep the most important parts in both. So I think we.
Right. And that is, I have also put in the chat section, if you want to follow any of those links of the major websites that they did mention and talk about that are good resources, a good, reliable, trustworthy, recommended resources. You can go ahead and click in those. In terms of the current situation, I know you mentioned the CDC. In terms of the current situation, when information, in a case like this, news outlets are picking up a lot of information, so you're kind of getting bombarded with different, different outlets. What would you recommend in that case? In a case like, I mean, it's so rare that we find, but the pandemic where, or
right.
sometimes you have, flu season, whatever, something that gains the national consciousness, you're kind of getting bombarded with different sources of information, and some seem reputable, because they are the news, or they're this, or they're that. But how would you recommend maybe double checking the information you see in the news?
So a lot of the information that gets put out there, I feel like sometimes it gets put out too fast before, news comes out so fast now, and so does the research. So a lot of times it could be outdated by the time you see it, especially if you're maybe seeing, if you don't see the news article as soon as it comes out, by the time you see it, it could be outdated already. But either way, if you're looking at it, you just got to keep thinking of those hallmarks of quality. Check the time, check the date, check their sources. If they don't, cite any source where they got their information from, then you probably should go to a more reputable resource like the CDC or one of those organizations.
I would second that on the sources. Yeah, the sources I think are probably most important there, because if they're just getting information from an unreliable source and they don't mention it, that's really important.
Yeah, that makes perfect sense, and I think it's something we are coming across so much, and that is actually true for all information you're researching and you're finding.
Yes.
You always want to go back and cite your sources. We say it, in health information. In the library world, we say it all the time. Students hear it all the time. You got to check the sources that are cited. You got to see where the information really truly is coming from. Well, we don't have any more questions, but that actually just takes us to the end of our program today. So we're just about out of time. I want to thank both of you once again so much for doing these presentations with us. I want to thank everybody for, we do have a comment that says, thank you, excellent. So I do want to share that I agree. Thank you, excellent presentation, excellent information. And I do want to thank everybody for joining us today. And if you are watching this live, please just a reminder to take a few moments and fill out that survey after the presentation. Otherwise, have a good evening.
Thank you.
Thank you.